Physical examination is an essential component of shelter animal intake and can be conducted by trained laypersons operating under a veterinarian design protocol. Objectives of the intake physical examination include establishment of baseline information about the animal's health, identification of urgent needs, including infectious disease concerns, and identification of needs that may arise during the shelter stay. Prior to conducting the physical examination, equip the examination area with the following items: leashes, pet carriers or similar humane restraint equipment, a digital scale, single-use disposable examination gloves, a stethoscope, a medical record, a thermometer, and a universal microchip scanner with fresh batteries. Physical examination should be conducted with a minimum of 2 people, an examiner and an animal handler. One of these people can serve as a scribe to record findings in the medical record. Prior to handling, observe the patient from afar to identify any obvious injuries or disease states, whether it's safe to proceed, and whether particular forms of personal protective equipment should be worn. If the animal appears safe for continued handling, slowly approach the pet and guide them to the scale to obtain a body weight. A thorough scan with a universal microchip scanner can also be conducted at this time. Starting between the shoulder blades, be sure to hold the scanner close to the animal's coat and slowly pass it over the entire body, including over the rump and under the neck. Physical examination should follow the same order each time it's conducted. The simplest method is to begin at the head and proceed toward the tail. Gently lift the pet's head and assess their nose and eyes. Note any nasal discharge or any discharge, redness, or squinting of the eyes. Gently lift the pet's lip and assess the color of their gums. They should be pink. Note any obvious dental abnormalities, including severe dental tartar, broken teeth, and signs of oral ulcers, blood, or pus. If the animal's age is unknown, inspect the teeth and determine an approximate age. Next, look inside the pet's ears and note any discharge, redness, or odors. Gently pinch and lift the skin at the back of the neck to assess hydration status. The skin should snap back into normal position upon release. Gently run your hands along the sides of the neck and down the front legs, feeling for any wounds, lumps, matting, or loss of fur or other abnormalities. Note the length and condition of the pet's claws, and if they allow, lift each paw and visualize the foot pad to check for injuries. Continue running your hands along the sides of the chest, abdomen, back legs, and feet. Note any abnormalities or signs of discomfort. Palpate the waist and hip bones and assign a body condition score. If you are familiar with the use of a stethoscope, use it now to assess the heart and lungs as you continue to observe the pet's breathing, noting any difficulty inhaling, exhaling, or any abnormal noises. Gently lift the tail and inspect the anal region. Note any redness, discharge, or fecal staining that could indicate the presence of diarrhea. Evaluate the reproductive organs and confirm the animal's sex. Note the presence or absence of testicles in males, a spay scar on the abdomen in females, or a tattoo indicating previous spay-neuter surgery in both males and females. If obvious signs of infectious disease or severe illness were noted during examination, and the pet will allow it, use a clean, lubricated digital rectal thermometer to obtain a body temperature reading. Once the basic physical examination is complete, the examiner may wish to re-examine any abnormalities or areas of discomfort in greater detail. The medical record should then be reviewed for completeness and the pet placed into its assigned housing unit. Finally, the examination area should be cleaned, disinfected, and prepared for the next patient.